Good morning, good afternoon, and welcome to everyone. We will just allow 1 more minute for participants to join, and then we will get started. So for participants joining today now, we are allowing 1 more minute for participants to join, and then we're gonna get started.
Domi?
Yes.
There are people on the other link, on the Teams link for the task force meeting.
Yes, so let me check. Hello, everyone. So good morning, good afternoon, and welcome to this webinar. So my name is 𝗪𝗲𝗁𝗏, and I'm really pleased to welcome you on behalf of the GNC Anticipatory Action and Nutrition Task Force to this, which is our first session of a webinar series on anticipatory action and nutrition. And next slide. So we have a very exciting agenda ahead of us. So I will first start with a short introduction to provide some background on the task force and the webinar series, along with some housekeeping rules. And then we will move to the 2 presentations from WFP. So we will learn about the WFP new guidance to support integration of nutrition and diet in anticipatory action system. And then we will hear from the Kenya office about their very practical country example. Then we will have a time for a session on Q&A, on question and answer, where you will have the opportunity to ask your question and also share any comments. And finally, we will close our webinar. Next slide. So let me first introduce Anticipatory Action and Nutrition Task Force. So this initiative was launched in July 2025 as a joint effort between the GNC Climate Crisis Working Group and the Nutrition Information System Working Group. So anticipatory action had already been identified as a focus area for the GNC Climate Crisis Working Group. However, given the growing interest and including the fact that now it has become a specific work stream in the context of the Unitarian Reset, we thought it was interesting to have a dedicated group. And by joining forces between both the Nutrition Information System Working Group and the Climate Crisis Working Group, we ensure that we cover all the different aspects of the system. So from early warning and trigger mechanism to activation and implementation of action, as well as monitoring, evaluation, and generation of evidence. So the aim of this group is to drive concrete action aligned with country-level priorities, and this by supporting tools development, sharing of country experience, and learning across contexts. So you can find more details on our dedicated web page. So here is the link. And we have already some resources available. So we are working on a mapping of the existing initiatives and resources related to anticipatory action and nutrition. There is also a lesson learned that has been developed jointly by the GNC and ACF France, available online. And here is a new exciting part. We are launching today the webinar series on anticipatory action and nutrition. Next slide. So now let's just talk a bit about the objective of the webinar series. So first, we want to explore the best country practices and operational tools that are already out there. And there are really good examples that already exist and that can really inspire us and guide us. Second, we aim also to foster a change and creating really a space where we can discuss how to integrate anticipatory action into nutrition programming and vice versa, how we can integrate nutrition into anticipatory action programming. So this is really about learning from others and building strong approaches together. So what's coming up? So as we kick off today with our first webinar, I'm also very happy to announce that there is the next session will be in January the 20th. And we will dive into lessons from two countries, South Sudan and Yemen, and their experience in implementing, looking at anticipatory action for nutrition in those high severity contexts. So, and what will be the next steps? So, and how you can get involved. So, if you're interested in sharing your experience or tool, please just feel free to contact us to join the dialogue, and we can see how we can together schedule a webinar as part of the series. Next slide. So before we get really started into the presentation, I just wanted to share a couple of housekeeping rules. So first, the webinar is recorded. So the webinar recording, the slide, and other resources will be posted on the GNC website and shared with you all soon afterwards. Please, so I'm just inviting you to introduce yourself in the chat box. So you can provide your names, where you are listening in from, and so that we know who we all are on the call today. Please, during the webinar, keep your mics and cameras off to save on bandwidth. If you have questions during the presentation, please feel free to post your question in the Q&A box. So this is the one you have between the shared screen and the show captions, and we will go to those questions when during the Q&A session. But there will be also opportunity during the Q&A session to post your question directly and to pose your question directly to the speakers. And for that, we will ask you to raise your hand, and so that we will unmute you. And finally, if you have any other general question or comment, please put them in the chat. We have one colleague who is monitoring the chat, and she will help you if you have any concern. So with that, next slide. So I just, before really starting our presentation, just want to acknowledge the partners for this webinar. So WFP, who is presenting today, and Action Against Hunger Canada, hosting the GNC operation team, organizing the webinar, and also our donors, so 𝗔𝗂 and 𝗔𝗁𝘁𝗶𝗶. The two donors have been supporting our work on the anticipatory action and nutrition over the last months. Next slide. So let's get us started with the presentation. So today I'm really excited to introduce our two speakers. First, 𝗂𝘁𝗁𝗏. She's nutrition officer at WFP ROM. And the second presentation will be delivered by Lynette Dinga. She's the head of nutrition in WFP country office in Kenya. And finally, myself, so I'm the Nutrition, Climate and Anticipatory Action desk within the Global Nutrition Cluster, and I will support the facilitation of the Q&A session. So with no further ado, Nicoline, I pass over to you for the presentation. Thank you.
Good morning, everyone. Thank you, Domi, for the introduction. It's my real pleasure to be here today and to be able to share with you the work that WFP has been doing on the development and the launch of the recently finalized guidance on anticipatory action and nutrition. So before Domi took up her current role with the Global Nutrition Cluster, she was our colleague in WFP, and she had been the leading force behind the development of the Anticipatory Action and Nutrition Guidance. And she worked in the development of this guidance very closely with colleagues from the WFP Anticipatory Action team, as well as with the country offices in the development to make sure that it's practical, relevant, and brings in the experiences from different countries. The guidance has now been launched internally in WFP and is being translated to French and Spanish. And we aim to make it available for an external audience next year, as we hope it will be helpful across the nutrition partners to further strengthen the existing anticipatory action plans by incorporating nutrition, which we believe is more critical and pertinent than ever in the current difficult funding landscape for nutrition and the profound changes in the humanitarian context. So in today's presentation, I will set out very briefly on how WFP defined anticipatory action, why we think it is critical to integrate anticipatory action and nutrition, and I will cover very briefly what the guidance covers, in particular setting out the key opportunities where we have the chance to integrate nutrition into the anticipatory action during the design, implementation, and monitoring. And then we have our dear colleague Lynette Dinga from the WFP Kenya office to share the recent experience of a drought-related anticipatory action plan that was launched this year. The next slide, please. So how does WFP define anticipatory action? So it is really important to distinguish anticipatory action from a regular emergency response, as well as from a disaster risk reduction, preparedness, and contingency planning. I mean, they're all really closely related, but anticipatory action is quite distinct. Disaster risk reduction really focuses on the long-term measures to reduce vulnerability and to enhance resilience to future hazards. Well, as we all know, preparedness is much more around planning and capacity building that improve the general emergency response capabilities. Contingency planning is the development of a predefined response strategy to various potential crises, taking into consideration existing gaps and capacity. But these plans do not necessarily include pre-agreed triggers or funding mechanisms as we do for anticipatory action. So anticipatory action is very much a forecast-based pre-crisis and a highly time-sensitive action. So for WFP, anticipatory action has been quite an innovative approach that really built on scientific advancement in predicting extreme weather events that allowed government, WFP, and other humanitarian actors to act ahead of a predicted hazard to prevent or reduce acute humanitarian impact before they fully unfold. So why does WFP then aim to integrate nutrition in anticipatory action plan? So we all know that extreme weather events like droughts, floods, and cyclones really significantly impact malnutrition and poor diet to complex interconnected pathways. Those events that undermine food security, they limit access to nutritious food and essential health and nutrition services, and also damage often water and sanitation system, which then can lead to increased disease outbreak and negative coping strategies that further reduce dietary quality and care. Anticipatory action has proven to be impactful and a cost-efficient approach to reducing humanitarian needs. So in 2024, WFP conducted a review of evidence from its own anticipatory action activation over the past 10 years. And then the findings showed that recipients of anticipatory action assistance experience higher food consumption, improved well-being, and reduced reliance on crisis coping strategies compared to those that did not receive assistance after a flood or a drought occurred. So also in line with the current WFP strategic shift towards wasting prevention, which is also in line with the WHO guidance, and the new WFP corporate strategy that was launched, I think earlier this year during the board. Nutrition is a so-called a cost-cutting priority around enabling nutrition and healthy diet. So therefore, there's a key opportunity for us to leverage anticipatory action that is traditionally focused on safeguarding food security and livelihood to also protect diet and prevent undernutrition, and in particular focusing on self-wasting and maternal undernutrition. So we really would like to focus here on the nutrition at risk groups that include in particular infants, children, young children, and pregnant, breastfeeding, and women and girls, who are usually disproportionately affected by climate shocks. And to do this, we need to systematically integrate diet and nutrition consideration into anticipatory action plan. The next slide, please. So what is the scope of the guidance? So the guidance is very much a practical guidance that is primarily intended to support our program teams in the country offices to integrate the diet and nutrition consideration into the design, implementation, and monitoring of anticipatory action plan that relate to predictable weather shocks like drought, floods, and storms. As I mentioned, the guidance was developed in close consultation with our country offices to draw on their practical experiences, as well as to ensure that the guidance meets the needs of the country office staff. So the guidance really aims to ensure that nutrition is adequately considered in any WFP-led or supported national anticipatory action plan, with the ultimate goal to prevent or mitigate the impact of predictable extreme weather events on diet and nutrition of at-risk population group. So it kind of sets out the different pathways between extreme weather events and diet and nutrition outcome. And then we also look at identifying nutrition entry point across the anticipatory action process, which include risk assessment, setting of triggers and threshold, identification of programming options, and monitoring. And then, of course, it also sets out the importance of coordination and engagement across teams within WFP and with other national actors. I will come to that later in more detail. So can I have the next slide, please? So this kind of gives an overview of what the practical guide looks like. So the practical guide is very much aligned with our WFP organizational approach to anticipatory action. So it's very much complementary to the already existing WFP anticipatory actions by providing specific support how we can effectively integrate nutrition to anticipatory action plan. So we have the overall essential guide that kind of sets out the key consideration and the 4 key opportunities that exist to include diet and nutrition consideration throughout the AA process. As I mentioned already, starting with the risk and impact assessment, the trigger mechanism, the development of anticipatory action plan, and action, intervention, and M&E framework, But then we also have complementary materials. So one that really sets out the rationale, why it is important to integrate nutrition in anticipatory action plan. This can also be very much used when engaging with national actors or when trying to mobilize resources from donors to really have a convincing case why it is important to integrate nutrition to anticipatory action. The second one is very much a checklist that staff can use during the design to kind of guide them through the process. What do they need to look out for to make sure that nutrition is well covered into the anticipatory action plan, but also for other colleagues at more management level or at technical oversight level to kind of review existing or draft anticipatory action plan to kind of double check have we done the most that we can to make sure nutrition is adequately covered in anticipatory action plan. And then the third one is kind of giving very concrete programming options for integrating nutrition to anticipatory action plan that of course need to be context specific and really separates out options for slow and rapid onset of context. Can I have the next slide, please? So the first one is, of course, what are the key considerations for integrating nutrition into anticipatory action plan? So the first, of course, is very much the focus on protecting diet and to prevent wasting. So the anticipatory action plan should really aim to prevent and mitigate the impact of predictable extreme weather events on the nutritional status of at-risk population group, particularly by protecting diet and preventing child wasting and maternal undernutrition. So to do that, we really need to use context-specific diet and nutrition-related data that really informs the targeting mechanism, the trigger development, the monitoring framework, to really ensure that the anticipatory action plans are very tailored to the local context to enable informed decision on who to intervene, at what scale, and when. So related to that, to inform programming option, it is really critical to map out the enabling factors for nutrition. So it really includes looking at mapping of existing programs, partnership, what are the kind of technical operational capacities in the country, and what funding do we have to identify what can be leveraged for anticipatory action. So for WFP especially, it really means that we need to build on ongoing activities that WFP itself and its partners are confident in implementing or we have already ongoing. So for instance, in a country context where we already have a WFP nutrition program, it might be appropriate to expand the coverage to areas that are targeted for the anticipatory action plan, or adjust the program to incorporate anticipatory action-related intervention, or in some cases we might use another WFP program, for example, our General Food Assistance Program or the Food for Asset Program, as a platform to deliver additional nutrition support. And then, of course, the leadership and the role of nutrition focal point is critical. Usually within WFP, the design of anticipatory action plan is led by the country office, anticipatory action focal point, who is then required to coordinate very closely across the different technical and operational units. Within WFP, that would, for example, mean the emergency preparedness and response team, the supply chain, the monitoring team. But then when we want to have nutrition-related anticipatory action included, we really need to ensure that the nutrition focal point is also part of the design, implementation, and the monitoring process. And then, of course, it needs to be context-specific and really align with the national priorities in coordination with international, national, and local nutrition partners. So we would need to ensure that the anticipatory action plan are aligned with emergency response system, the current disaster risk management protocols in place. And for this, we need to work very closely with government institutions, relevant national bodies, to ensure that they are on board and can have the buy-in and also can implement part of the anticipatory action plan where relevant. Generally, we find that the awareness of the potential of nutrition in anticipatory action plan is quite limited among national and local actors. And therefore, it's really critical for all of us and for colleagues as part of the National Nutrition Coordination Platform to be engaged as early as possible and support the work of the technical working group for AA at subnational or national level, and really also bring in other relevant clusters, in particular food security and livelihoods, health and WASH, the social system, to really ensure that we have a coherent multi-sectoral anticipatory action approach to leverage existing opportunities to support nutrition and diet outcomes. The next slide, please. So now I really would like to take you to the 4 key opportunities that we have to integrate nutrition into AA. And the first opportunities that we have is right at the beginning of the development cycle of an anticipatory action plan. That is when you start assessing the risk and impact. So to really ensure that the anticipatory action plan effectively protects diets and the nutrition and prevent wasting, it is really critical to understand how and where climate shocks affect nutrition in that particular country or context or region, who is most at risk and why. So the key question to answer is, how do the climate shocks impact nutrition? Well, this can be done by analyzing timelines of how shocks in the past have unfolded, by overlaying information on shocks with information, for example, on the key drivers of food security and malnutrition. And this analysis helps you to anticipate how the food security, quality of diet, and nutrition may deteriorate during a future climate shocks. And then at this stage, it's also critical to develop a crisis timeline by mapping out the sequence of events that leads to a nutrition crisis. So really starting from the first early warning signs like little rain, increasing market prices for food commodities, to full-scale deterioration. And this might help you identifying where the nutrition indicators might begin to decline. So that's the first question: how do climate shocks impact nutrition? The second one is very much, of course, on the where and the who, the geographical targeting and the prioritization of particular vulnerable groups. And this decision should be based on the understanding where the shocks are most likely to occur and who is the most vulnerable. The risk areas where shocks are most likely to happen or impact should be overlaid with nutritional hotspots based on pre-existing nutrition vulnerabilities across the different regions and population groups. For example, where we find persistent poor dietary diversity, where we have high levels of food insecurity, where we have persistent lack of access to healthcare and WASH. And in those areas where the exposure to shocks overlaps with high nutrition risk, nutrition intervention are needed to reduce the risk of increased malnutrition and child mortality. And then in that analysis, it's also really important to distinguish between slow and rapid onset of shocks. For example, floods and disease outbreaks may disrupt access to food more rapidly, whereas with slow onset of shocks, such as drought, the impact will emerge with some delay and then slowly lead to reduced food availability and increased food prices. So can I have the next slide, please? I think the next slide, I think we are 1 slide behind. Yeah, step 2. So this is really about deciding when to act while developing triggers. Sorry, I think we are too far now. Can you go back, please? Step 2, please. Yeah. So the second step is very much on deciding when to act by developing triggers. So the impact-based forecast gives information on what the weather will be like and what the likely consequences are for people and infrastructure by considering the local vulnerabilities and exposure. So an anticipatory action plan should not be initiated because a drought or flooding is happening, but because we expect significant impact on nutrition. So climate and food security indicators alone are not sufficient to decide when to act. Nutrition impact-based triggers are key for ensuring timely and targeted anticipatory action related to nutrition. So, for example, nutrition impact-based forecast triggers need to reflect a correlation between a specific climate variable, for example, lack of rain, and a subsequent and significant change in diet and nutrition-related indicators, for example, the cost of diet. So, for example, WFP in Zambia, we looked at more than 10 years of monthly price data for food between 2012 and 2025. And then we used those data to estimate the cost of a nutritious diet for the different household members. And those costs were then linked to household food expenditure to kind of track the affordability of food over time. And this time series model shows that when certain El Nino conditions and dry vegetation conditions were met, the nutritious diet cost would increase very sharply about 3 months later. So this gives you an indication when to act. So it really said, okay, when to act is when do we trigger the AA intervention, and also how to act. For example, the model in Zambia predicted a 26% increase in cost of diet. And then this information can also be used to inform the value of the cash transfer to ensure that the cash transfer also meet the nutrition requirement. And also this analysis in the time series also helps you to decide where to act, based on where the risk is expected to happen. So, for example, which regions have the highest levels of non-affordability of diets. Can I have the next slide, please? So, and then the third step is, of course, what kind of anticipatory action can we identify that can help us preventing or mitigating the impact of extreme weather on diet and nutrition. And this should be really tailored to the specific ways in which the climate shocks are expected to affect the diet and nutrition status of vulnerable individuals. So based on the robust understanding of how the risk pattern links to the how, the where, the who, and the why, we can then, the hazard type, are we looking at a rapid or slow onset? It will then be possible to design context-specific nutrition actions that address specific risks. For example, food access, the care practices, availability of services, or the access, whether people can actually go to the services that are being offered. But we also need to be very specific on the limited window that we have before a crisis unfolds, especially when we're looking at floods-related anticipatory action plan. The window to intervene is very short. And then quite often there's the belief that nutrition actions are perceived as being costly. There are very cost-effective ways to adapt existing intervention to enhance the diet and nutrition outcomes for young children and pregnant and breastfeeding women and girls. For example, we can look at early warning messages, anticipatory household food assistance, for example, to cash transfer. These are very kind of central component of many of the WP-supported anticipatory action plan, and offer important entry point for supporting diet and nutrition objectives. But this, of course, will vary from organization to organization, depending on their mandate and the resources that they have. The early warning messages offer an opportunity to reach communities with essential messages on nutrition, diet, disease outbreaks, and hygiene ahead of a crisis. Anticipatory cash, potentially combined with a nutrition top-up, has a strong potential to support both household and individual dietary intake, as well as supporting access to basic services. So the evidence that we have shows that anticipatory cash is usually spent on food first, but then often followed by other basic expenses such as healthcare. The household food assistance can be both conditional, unconditional, and could also be looking at different factors. For example, the transfer value that I mentioned in step 2, what is the actual food gap and the affordability gap? What is the best transfer modalities? Is it better to provide cash so people can go to the existing market, or when markets are no longer functioning, is in kind or vouchers a better way of transferring the support. And then, of course, the frequency and the duration that will also be very much linked to the type of hazard that we're looking at. There are also, of course, some nutrition-specific intervention that we can look at. For example, screening for early detection of acute malnutrition, and then making sure that referrals are in place. But this should only be considered if we still have existing nutrition services in the area that we are planning to have the anticipatory action modality. And we also need to consider the operational readiness to deliver timely and effectively. So in terms of readiness, we need to look at training of staff and partners on AA-related tools. We need to look at pre-registration of targeted household. I think Lynette will provide an example of that for the Kenya country office. We need to look at having agreement in place, for example, for financial service providers that can deliver the CAP-based transfer, or where in-kind support is provided of specialized nutritious food. We need to make sure that those are pre-positioned in the relevant area. We need to work on the tailoring of early warning messages. So once we want to trigger the anticipatory action response, we have the messages ready to go. We need to look at our supply chain readiness to look at whether the local markets have sufficient availability of nutritious food and, for example, fortified food. So some examples for the slow onset. I already mentioned early warning messages around, for example, water scarcity, related to food insecurity, alerting people to potential disease outbreaks for people, but also for livestock. The additional cash transfers, looking at rehabilitation of water sources, the distribution of early maturing or drought-resistant crops variety, as was done in Lesotho, for example. For the rapid onset of floods, I think the intervention window is very short, and again can involve examples around early warning messages, cash transfer, but also safe shelters for women and to support breastfeeding and cooking facilities, and of course mobile nutrition services to mobile farms, or as the health services are no longer likely to be impacted by the floods. Can I have the next slide, please? So, and then the last opportunity, which is super important too, is how do we monitor and measure the effects of anticipatory action on diet and nutrition? And this is really important because it helps us to understand what nutrition approaches in anticipatory action plan works, for whom, under what conditions, and why. And these insights can help us to inform program adjustment and improve the quality and effectiveness of anticipatory action plan. And this can also help us to assess our operational readiness. Are the systems and the partnership and the process that we have in place in WFP, but also within any of the organizations that you work, or within the kind of cluster arrangement, are those able to deliver timely and efficient sorry, my voice. So are the system and partnership and process in place to deliver timely and efficient nutrition assistance once the trigger is being activated? And then, of course, having clear monitoring data and clear results, they will also support us with advocacy, with the community, with partners, with the government, with donors, to invest in anticipatory action and nutrition. So, but how do we do that? How do we strengthen our current M&E system in the context of anticipatory action, looking specifically at nutrition and diet outcomes? So this is very much specific for WFP, but we are looking at integrating relevant diet and nutrition-related indicators in log frame. So we're looking at indicators related to diet quality, the minimum acceptable diet for children, for example, or the minimum diet diversity indicator for women. We can look at the food consumption score, the infant young child feeding practices, and we can also try and enhance existing anticipatory action and M&E framework, and really include diet and nutrition-related questions in, for example, the post-distribution monitoring that WFP does, or in the after-action reviews and the impact evaluation. The disaggregation of data by gender and age is also really important to monitor to what extent have nutrition vulnerable groups, such as children under 2 and pregnant breastfeeding women and girls, been reached. But then to have effective monitoring system in place, we really need to plan for adequate technical capacity and resources in the M&E budget for Anticipatory Action Plan to make sure that the data is timely and effectively collected using representative sample sizes and the use of available nutrition diet-related data. So, for example, in Somalia, the WFP team was involved in the activation of an anticipatory action plan for the 2023 floods. And then as part of the monitoring, the food consumption score was weighted based on whether a household received nutrition commodities in addition to the anticipatory cash transfer. And then we found from the data that the household that received nutrition commodities showed a better food consumption score compared to those that did not. And this suggests that nutrition supplies help to maintain or improve food security. So I've come to the end of kind of a conceptual overview of how WFP aims to support the integration of nutrition in Anticipatory Action Plan. And now I would like to give the floor to my colleague, Lynette from the WFP Country Office in Kenya. She will share some very interesting and practical example of how nutrition was incorporated into the Anticipatory Action Plan, which was activated earlier this year. And if I'm correct, there's some data collection ongoing to kind of look at the results and also the lessons learned. So over to Lynette, please.
Thank you, Nicolene, and hello, everyone. As indicated, I'm Lynette Dinga from World Food Program based in the Kenya Country Office, and really glad to share our experience on anticipatory action, this being a first for us as well. Next slide, please. So for Kenya, looking at our anticipatory action plan, I will give reflections from how we began the process, and mainly this relates to discussions that we were having with government at the national level. And earlier this year, around February, we were looking at the projections for malnutrition and impact that are already projected in regards to a deteriorating nutrition situation. There was need for us to put together with the different stakeholders through a coordinating platform that exists, that is the Emergency Nutrition Advisory Committee, to put together an emergency preparedness and anticipatory action plan. So this also considered how the funding situation had evolved at that time in February, and looking at what actions we need to position ourselves in. Further, there were discussions that were held at the country at national level and also at the lower levels, that is the county level, in terms of looking at how we can support the counties to put together an anticipatory action plan. So mainly, these discussions were being led through technical working groups. So at the national level, we had government leading this through technical anticipatory action technical working group that was situated at the national level. And also we had the sub-national level, the county level technical working groups that discussed on anticipatory action. Mainly, these technical working groups are led by the National Drought Management Authority, that is a government-mandated entity that looks at issues of drought, and also working closely with other government agencies, such as the Kenya Meteorological Department, that helps to monitor seasons, and also working together with the National Drought Operations Center. So these coordinating agencies that sit at the national level where also as an agency, WFP, the Ministry of Health, and also other stakeholders contribute to. There is where we had the technical working group that coordinated in having the discussions on anticipatory action plan. And further, these were also further firmed up with the county level technical working group that constituted similar sets of related persons that represent from these government-led departments, as well as the stakeholders and other sectors, including agriculture and those related to livestock that came together at the county level to help in pulling together an anticipatory action plan. So we did work closely with 2 counties for Kenya that we were supporting through this process that are in the arid and semi-arid locations, that is Wajir and Marsabit. And mainly the objective of the plan that we were putting together was to reduce the impact of drought on food security and livelihoods at the household level. So from the onset, as we were pulling together this plan, was the deliberate intention of ensuring that we have nutrition represented in the discussions so that we are able to also reflect the nutrition actions that need to be considered for the anticipatory action plan. So the targeted locations, have already mentioned them, and mainly these were pegged based on the food security situation, because already these 2 counties, Wajir and Marsabit, we were already observing an integrated phase classification of 3 and acute malnutrition classification of 4. So they were already high-risk counties, and we were looking at trying to mitigate a further deterioration. Guidance from the national level technical working group was to look at the triggers which Nicolene mentioned. So the important component of an anticipatory action plan is having trigger levels that inform on a pre-agreed action that requires pre-agreed finances that will help us to monitor the impact that we are aiming to achieve. So in terms of the triggers, the key triggers based on the discussions that were held at the national level, led by the National Drought Management Authority and the Kenya Meteorological Department, was to look at the standard precipitation index. So mainly this involved monitoring the rainfall patterns and agreeing on a set threshold of determining when and do we determine when to activate anticipatory actions. So for the 2 counties, for each we did have an establishment of the thresholds that will help inform on the deteriorating situation. So our anticipatory action plan was mainly for drought. As Nicolene mentioned, you can have an anticipatory action plan for drought or for floods. So the one we had that I'm speaking to is on drought. And hence the trigger levels that we were looking at was the standard precipitation index that will help to inform on the likelihood of a drought scenarios. So these thresholds that were set also looked at the variations, the varying levels of drought based on either a mild situation, a moderate, or a severe situation, based on agreed upon targets that would inform on the same. So this helped to inform on the plans and the actions that we would need to put in place. So there were a variety of actions that were agreed upon by various partners. This was government-led. And the actions were varied, but the ones were based on the approval that we got for the plan, and we were able to support from the WFP end, were aligned to 4 key areas that we were looking at. And the first is the dissemination of relevant climate early warning information and related advisories. Secondly, also a key action that we were contributing to was the provision of a targeted cash-based transfer to the vulnerable households. Thirdly, now for interest of nutrition, was for us to ensure provision of cash top-up to the same households that would receive the cash-based transfer, targeting children under 2 and pregnant and breastfeeding women and girls. And lastly was also to make sure that that cash transfer is followed closely with social behavior change communication so as to strengthen community-based resilience and nutrition outcomes. The target numbers that we were aiming to reach from the plan was about 462,000 people in relation to the first activity area, and for the cash transfer was about 64,000 people. For nutrition, our target was to cover 50% of the households that would be reached with the cash-based transfer, knowing that for nutrition, mainly we target individuals, while for the cash, we target households, and also for the messaging to be able to follow in tandem with the cash that will be dispersed. So for Kenya, based on our lean season, it runs between July and September. And during this period is when we were closely monitoring on the climate advisories to inform on the standard precipitation index and our ability to reach the thresholds. Next slide, please. So an important component on the principles of activations that we agreed with the government at national level and also at the subnational, the county level, was that for nutrition, we will use the standard precipitation index as a foundational trigger to inform on activation for anticipatory action. And in complementarity, we will use also nutrition indicators to help us in confirming the severity and also inform the geographic targeting. So this we were able to map out with the data that I had mentioned. We have through the food security classifications as well as nutrition security classifications, and looking at also routine data that is collected by the National Drought Management Authority, looking at the admissions for severe acute malnutrition, as well as milk production, and the routine monitoring that they use to check on the mid-upper circumference levels of the satellite locations. So this helped to inform on where we can, the geographic locations that we need to prioritize, and also as we position with the foundational trigger in terms of activation. Next slide, please. So as I mentioned, for Kenya, our lean season runs between July and September. And how we did this is that working closely with the Kenya Meteorological Department that helped to track on the rainfall performance, we had in July monitoring against the standard precipitation index thresholds to inform on the initialization of anticipatory action. And that means that in July, we were looking at the rainfall performance against the targets that had been set for each county. If you see the two maps, on the left, we have Marsabit County, and on the right, we have Wajir County. So this is September data, but we had been progressively tracking this through government information from the Kenya Meteorological Department that helped to show us that even as of July, at the initialization phase, we were already reaching the thresholds for activation, that is of a likelihood of a moderate scenario when it comes to drought. So this we progressively monitored in July and also in August. It helped to inform for readiness for us to be able to have readiness for anticipatory action, which there were high indications that we would indeed trigger for anticipatory actions. And in September, this was confirmed based on the rainfall performance that we did. Indeed, we are looking at a high likelihood of both severe and moderate situation for anticipatory action that varied also across the different regions as indicated up to the lowest subnational levels. Next slide, please. So as mentioned, based on our plan at the initial that had pre-agreed actions and also based on the approval of pre-agreed finances that would help us to kick things off, and with the monitoring of the triggers and the confirmation of the triggers as of the September, then we kicked off in terms of the key activities that had been pre-financed for us to support the counties with. And as mentioned, those were the activities that were to be undertaken, the messaging, as well as the cash transfers and the nutrition top-ups, and also monitoring the implementation of the same. So we did continue engagements through the coordination platforms. I mentioned about the technical working groups. We made sure that we encouraged participation, especially from the government focal points and ourselves, to be at the table in terms of guiding the discussions and looking at how the trigger levels are evolving and the preparation for these actions to be rolled out. And also in preparations even of the targeting process, of which in Kenya, we've been working closely with the government in supporting data registration through the enhanced single registry, which facilitates linkages with social protection support. So looking at access to this data to already help us facilitate the targeting process that will be initiated, as well as community engagements, just to provide them with the information of the incoming drought, as well as the preparation activities that will be necessary for the same. As mentioned, for the first time, we were including nutrition for anticipatory actions, and we also did consider the processes that we'll use to target for nutrition. And our interest was to ensure that we are able to include the vulnerable populations, and we gave a consideration for children under the age of 2 years, and also the pregnant and breastfeeding women and girls. So this was a key targeting criteria that will be layered upon the targeting criteria that was to be used for the cash-based transfer at the household level. And all this had to be presented to the technical working groups, both at national level and also at the subnational, that is the county level, so that all are in alignment, and also the county level officials, mainly led by the government, are the ones who led in terms of community sensitization and mobilization, and informing them of the targeting criteria and the processes that this will be used to roll out. In terms of the messaging, we also had great engagements with the government across sectors to review the messages that will be passed in terms of climate information and also for nutrition. A challenge, of course, that we faced for nutrition is that we had not done this, we had not put in messages that were specific to anticipatory actions, and we pulled out messages that we had through the maternal, infant, and young child nutrition approaches that we've used, and built on that to see how we can align them to better communicate to communities on ensuring that they have enough stocks during the preparedness period, as well as making sure that they are well positioned with the information that we were passing. So this had to be done quickly, and also aligned with the counties in terms of ensuring that they will be communicated effectively and they were translated to the various languages for better understanding. So as we were kicking this off in September, as we got into October, we made sure that the evaluations were kicked off. So the important thing is that we came in, we had to do a baseline survey with support of our monitoring and evaluation colleagues, so that we have a baseline data. Soon after the targeting process was undertaken, we undertook the baseline data collection, and then the cycle of disbursements were undertaken. So we were looking at 3 cycles of cash being transferred to the targeted households, which was to cover the period of September, October, and November, with follow-on messages being disseminated through different platforms, including interpersonal communications through the community health promoters, as well as community dialogue sessions, and through radio, which were quite interactive, and the bulk SMSs. So these were channels that we had to prepare the information, make sure they are well positioned, and also work with the government and partners to make sure that they are timely disseminated. So these disbursements have since been done for the 3 cycles. And also we have done, as Nicolene had mentioned, indeed, we have undertaken the end line and we're in the processes of finalizing the report to inform us on the differences of the indicators that we are monitoring at baseline and how they've come in at endline. We did include learning questions to help us learn more from the process. As I mentioned, this was a first, and it will build to the learning not only at the subnational, but also at the national level. Next slide, please. So the progress in terms of the implementation which we've had, I've mentioned that we did provide cash transfer, and the amount of cash transfer that we dispersed was $79 to each household, and this was aligned to the minimum expenditure basket at 50%. So this is what we provided, and we were able to cover roughly the amount translates to 10,500 Kenya shillings through the 3 cycles. In addition, the same households that were being targeted based on vulnerability to get the cash transfer, we gave them an additional cash top-up of $7. And this mainly, we tried to look at, what is the gap in terms of the caloric requirement for a vulnerable child or a mother, and also looking at the minimum expenditure basket. So based on the calculation of the proportions, we did look at the amount that would be suitable to disperse as a top-up to these targeted households. I mentioned the targeting eligibility criteria. Of course, a challenge we had was estimating on how many children do we expect, how many children and pregnant and breastfeeding women and girls would we expect to reach from the households that are targeted with cash-based transfer. Since at the point of planning, we didn't have these numbers at hand, but we worked with an estimate of a reach of 50%. And after the disbursement, we were able to reach 6,000 children under 2 and 1,320 pregnant and breastfeeding women and girls with the top-up. So the 50% estimate was able to help us well, because we were able to realize a close to 60% reach of the households that were targeted. Next slide, please. So I think just to mention, as I had highlighted, we use the enhanced single registry to help us with the targeting process. And also we made sure that our targeting criteria was aligned with the county authorities. There was a lot of community engagements which were government-led, and the messages had to be translated to local so that we ensured good reach and understanding. One thing for nutrition is that with our normal targeting process, normally we base it on vulnerabilities. And this time round, for us to better target for nutrition, we involved people who we call community health promoters, who work within the health system and have access to information of the community. So we did engage them during the targeting process so that they provide us with information of also having insights of households that have children who have moderate acute malnutrition or severe acute malnutrition, and also for women, so that we would prioritize them in the targeting process. So this was helpful, and we were also able to use them to help us pass information during the targeting process on the key messages that had been developed jointly. And also, as mentioned already, we used various platforms to make sure that there was good reach. And even during the follow-ups, you could hear really good reach even through radio, through the interpersonal engagements. There was some good reach from even the communication that we received from the beneficiaries. Next slide, please. So what are the lessons we've learned so far? As I mentioned, this was a first for us for WFP, and even in doing this in Kenya. And the successes which we were able to observe is that the process, it's important that it is government-led, and for nutrition particularly, how best we can plug into government-led coordination platforms. Like for Kenya, as I mentioned, we have the National Drought Management Authority that supports in this coordination at the national level. So how do we ensure that we are sitting at the table when we have these discussions, so that nutrition nutrition has considerations in the engagements. And also at the subnational level, we have the county steering group that is led by the highest entity in government at that level. So how do we ensure that nutrition is represented also in those discussions and in the engagements, including in the technical working group? Other successes were the successful use of the enhanced single registry, which are systems which for WFP we've contributed to building over time in Kenya, and also helped to strengthen the targeting process at the community level. So third key success that also we were able to see was, prior community sensitization ensured a good, smooth registration process. There was a lot of engagement, and we relied on the government structures from the top level even to the lowest level, including the chiefs and the lower level, in ensuring that we were all aligned and they were passing the right information. Also, linkages with the health system staff for ensuring that we were able to have effective targeting and messaging proved to be really helpful. And I think even from our validation processes, we realized we achieved quite high validation of targeting process than we have done even previously in our normal cash transfer programs. Of course, challenges, as I mentioned, being a first, there are a lot of learnings we have to undertake. And one of them was the delays in communication of the threshold levels. As I mentioned, we were relying on this information from the government side. So the information in terms of ensuring that we had the August readiness trigger levels communicated on time became a challenge, because this came in about 2 weeks late in, and also compromised on our ability to move fast and plan, including on the targeting process. Secondly was the sequencing of activities. Because of the very stringent timelines for anticipatory actions that you need to operate in, I mentioned there was some information that we didn't have prior, like nutrition messagings for anticipatory action. We were doing them in the process of activation. And I think in retrospect, if you have your messages early in good time, then it makes it easier through the process to just go through validation processes and the rollout. Thirdly, there was also long distances between the areas that had to be covered, and the work hours and staffing needs really to be taken into consideration, considering on trying to maximize impact during the targeting process to pass information and also ensure effective targeting. And lastly, the budget that we had for anticipatory actions that was approved from our end through the engagements that we had with the government, and also internally through our processes, and including through our regional and also our headquarter processes. The budget was, and what we were able to receive was, what we received was 16% of the needs that we needed to support anticipatory actions. And of course, this played out during the rollout, because the community needs were quite high and they exceeded the amount of resources that we had at hand. And also, being an election year coming up in the next year or so, there was a lot of political interest, and the need for evidence and data to navigate that became really critical in terms of the targeting process. Next slide, please. So lastly, I think, as Nicolene had mentioned, it's important after you have your triggers, you also have your pre-agreed actions, and you also have pre-agreed financing. It's important also to have learnings and also measure the change or the impact that we are looking at. And I had mentioned that we have already done the baseline and the end line. We're in the process of finalizing on the analysis for the end line. And I think some of the key questions that were of interest to us during this process was that we would wish to look at the awareness level and the receipt of the cash top-up and its utilization, how it played out, and also how effective the messaging was to support the behavioral aspects and perceptions and the challenges that were being faced by these communities during this time. We will also begin to see how effective was our targeting, and also the coordination and planning. What more do we need to put in place? And I think based on all this information, We are looking forward to undertaking an after-action review in January, just to consolidate all these learnings. But so far, really good feedback from the community. They were able to prioritize, as Nicoline had mentioned, they do prioritize nutrition and food. They were able to stock up. There was feedback even from the recent learning that we had. They were able to make sure that they have different food varieties at the household level, and this was able to help them to position well for the drought. So that's all from me. Thank you. And back to the chair. Thanks.
Thanks so much. I mean, to our two presenters, they were really exciting, insightful, and presentation. I think it was really valuable to have both of you. I mean, Nicoline presenting more the global guidance, and having you, Lynette, just showing how does it translate into practice and concretely with this example from Kenya. So I think it's really helped to bring like the concept to life. So we will now move to the Q&A session. So please feel free to drop your question in the Q&A box, or you can also raise your hand if you'd like to speak directly. Don't be shy. We have another 10-15 minutes for Q&A. I think I can see we have already maybe 2 questions in the Q&A box. They have been already partly addressed by Nicoline. Maybe I'm just going to read them. I think they are quite related. So the first question was about from Bana Abu Jude. We're asking whether there are other anticipatory actions related to nutrition other than climate. And the second question that was from Diane Moyer, asking if this plan only climate shocks, or could we adjust it to any type of shocks that could impact nutrition? For example, outbreak, affecting human health and crops, population movement, etc., and so on. So, Nicoline, I can see you have already answered directly in the Q&A box, but do you want to share a bit kind of your reflection on this?
Yes, sure. As I mentioned, the work that WFP is doing is focusing very much on climate-related anticipatory action plan. Of course, some of the climate risks will have a direct link to disease outbreaks, both for human beings or for livestock. For example, drought, right, will increase livestock vulnerabilities to diseases. But then, disease specifically, like pandemic, WFP is not part of WFP mandate, but I know that there have been several organization work done on AA related to pandemics. And I put a link in the chat. It was a global review done by Feinstein Center in the US, and it kind of gives some interesting insights. In relation to population movement, I'm not aware, but of course, when we have floods or storms or drought, we also see population movement, but I'm not quite sure whether in any of the modeling work, population movement are also part of the kind of trigger threshold, but I'm pretty sure that it's probably more linked to where do people go in terms of when floods happen or when a storm happened, and where do we need to make sure that we have services available. Domi or Lynette, would you like to add to this question?
Yeah, I'm happy maybe just to complement saying that, yes, I think, I mean, there are work being done right now to try to look at how we can predict shocks that are not only related to climate, so including, as mentioned, disease outbreaks, also conflict-induced displacement as a type of shock I've seen, maybe more shocks linked to agriculture, such as low cost. So yes, I mean, work is ongoing. There is a couple of resources that exist. So Nicoline mentioned one. There is also others. For instance, I know about a paper that has been produced by the Anticipation Hub with Red Cross Climate Center, looking at epidemics and so health-related shocks. So yes, saying that there has been example, I think recently, for instance, in South Sudan, where there's been activation of anticipatory action plan related to conflict-induced movements. So it's a new area, let's say, for anticipatory action, but the work is ongoing.
Yeah, maybe if it's okay, I can compliment.
Sure,
I think, yeah, I think also from our learnings, because as mentioned, we've used the standard precipitation index as a foundational trigger. We are in discussions with partners like Action Against Hunger to look at opportunities of also modeling other indicators for nutrition, of nutrition interest that could be complementary in terms of looking at triggers and also in informing on the actions and the planning that we can put in place. So I think these are opportunities for us to learn and build on even other shocks that can influence, or also on how we can maximize our nutrition indicators.
Thanks a lot. I see we have a new question in the Q&A box. So question from Jacqueline. Have you found nutrition risk vary from different hazards identified for anticipatory action? For example, flood versus drought. Nicoline or Lynette? Do you want to?
Yeah, maybe I can start off and
Yes.
maybe Nicoline can complement. So I think for drought, because what we've seen is mainly we've been keen to monitor on issues of acute malnutrition, which is an important indicator in terms of monitoring that and the related diet-related indicators that Nicoline had mentioned. So looking at food consumption score as a proxy indicator to food security, and also looking at the minimum acceptable diet and minimum dietary diversity. So these are some key indicators that we do monitor. And I believe for floods, likely it may play out as a similar scenario because we are anticipating a rapidly deteriorating situation. So we could have of interest still the acute malnutrition indicators, as well as the other diet-related indicators that we can continually monitor. Yeah, thanks.
Any addition from you, Nicoline?
Yes, so I think it is probably, it's quite difficult to kind of say a kind of one-size-fits-all answer to this question, because I think it really depends on the type of shocks and also the duration of the shock and the magnitude of the shocks, right? So if you have like very localized flooding, the impact will be quite different if you have widespread flooding and it takes a long time for the water to kind of pull back, and then also the impact on the access to health facilities, the access to market, the availability of food will be very different. So I think it's very context specific. For example, when we have a flood, the risk related to wash is probably much higher than related to drought. But also when we have very prolonged drought, we will still have reduced food availability, but we may also have issues around water, access to water, and people's movement. So it really depends on the context and the duration and the impact of a certain shock. Domi, would you like to add something to this?
Yeah, no, I mean, just agree with you. I think it's also about the dynamic of the way that, nutrition will be impacted by a drought is different from a flood, because, you may have a issue about disease outbreak, but for the flood, it's going to be much quicker, and it's going to unfold very quickly after a flood. Issue about water is really important. For the drought, it could come, as you mentioned, but it's going to take more time. The same with the flood. You can from one day to another just be completely isolated, and you won't have any more access to any health facilities. While in a drought, it's not going to be the same. You can lose people after a flood or a storm or a cyclone, so maybe you will not have any access anymore to your caregiver. For if you speak about your children, yeah, there are differences in the way nutrition is impacted by the different type of hazards, and but this needs also to be put into context. There is a new question in the Q&A box. Can I invite maybe Deborah? Do you want to raise your hand and just to ask directly the question to our speakers? Yes, Deborah.
Yep, apologies. I think I'm using Deborah's line, but this is 𝗪𝗯𝗶𝗃, Action Against Hunger.
Okay. Yes, please.
So just it was just a small concern, but first let me thank the team. I think they're doing some incredible work on in line to AA. That is much appreciable. Thanks for your presentation. Just a few concerns on the methodological and ethical considerations, especially on sampling. I came in late. I might have missed part of these discussions, but I felt that there is a need for maybe household matching and attribution of effects if we actually to make conclusive evidence in terms of the contribution of our intervention. So I was thinking along the lines of how the households were matched and compared across I would call it intervention and non-intervention groups. So if that did not happen, but my thinking it is at least so that we are able to, we might have used a baseline, like how were they before and how were they after the intervention itself. But I feel like there would be a factor of controlling other variables that may have influenced the outcomes. That is one. On the second one is the idea that the need, how are ethical considerations in population selection considered, also with understanding of the equity, I'll call it justice and benevolence, where sampling actually should target that when we are targeting some populations, how do we consider those that we may leave out during the intervention period, so that we may not deny them beneficial effects of whatever interventions we are doing. And then the third one is on the socioeconomic consideration in terms of selections. I realized that households selection were actually a factor of, if I got it right, a factor of household composition, how many children or children under 5, that is, but I realized that there could be also other socioeconomic differences across this household that contribute to vulnerability or the differences in livelihood types. And this actually, at one point, disproportionately affect household capacity to access food. How are these considered? Ideally, in making or accounted for in in considerations of the households that were actually put on the intervention category, so that we actually do not leave some households that might be needing more than others. That was just in an afterthought of whatever was presented in terms of the sampling methodology. Over to you.
Yeah, thanks for your question. Lynette, is it something you can you want to answer, or maybe partially?
Okay. Yeah, sure, Domi. And thanks for the question. I may answer it partially because I know it's something that was heavily handled by our monitoring and evaluation team. And it's part of, thanks, Abraham, it's part of questions that I believe we battled with in terms of thinking around the issues of the baseline and the end line. And in terms of intervention and control, no, we did not go the intervention and control way because of the challenges of because if you are to do a control, you need to already have a plan on how you're going to come in and support these communities based on ethics, so that we don't go in and collect data with no plans on what next for these communities. So what we did was that we focused on the targeted communities that were targeted for the anticipatory action. And maybe in relation also to some of the questions you've asked, the targeting process that we use is very much community-led and government-led. So what we do is that we have a targeting criteria that looks at the vulnerabilities that we need to take into consideration, including looking at child-headed households that are, women-led households, even male-led if they are vulnerable, and looking at also other socioeconomic factors that are predominantly used when targeting households for for support and also determining their vulnerability. So this targeting criteria was discussed and agreed also within the technical working group. And further, these were further engaged even to the lowest levels. It is the chiefs at the lowest levels that you are engaging to bring together the communities, explain to them the targeting criteria, and get an understanding of how best we can arrive at the people who fit this targeting criteria, and complementing this with the enhanced single registry that also does document the most vulnerable within those locations. So it was very much community-led and community engaged, and also looking at the vulnerabilities that are set to arrive at the same. So for the baseline, we sampled within those who had been identified for the anticipatory action, and also follow-up was done at endline within the same population. We used qualitative data to gather information around the learnings. Yeah, so I think that's the much I can share. Back to you, Domi.
That's fantastic.
Thanks so much, Lynette. I think it's already a lot to explain kind of the approach we have used in order to do the targeting and sampling. I think it's time for us to close the webinar. Next slide. I just want to again thank our speakers. I think it was a really insightful presentations. It's great to see the work which is being done on anticipatory action and nutrition, and that is really coming live with this example in Kenya. I also would like to invite you to continue sharing your experience. And next slide. So, and as I said, so we have now this new tool with this webinar series. It's an opportunity for any organization, any individuals who wants to also share experience in anticipatory action and nutrition. And just would like also to remind you that our next session will be in January the 20th, and it's going to be both teams from South Sudan and Yemen, and national actor from South Sudan and Yemen. We're going to speak about the work they're doing in integrating nutrition into national anticipatory action frameworks. With that, next slide. I just want to remind you that the GNC, if you're looking for support, the GNC is providing support in nutrition in emergency. There are different ways you can ask support. So you different type of support you can require. It could be remote or in-country technical support. You could have also. We could also support to hire a consultant directly, and you may want also a quick technical advice. In case you want more support in terms of peer support, we advise you to go on the ennet.org, which is the dedicated platform for it. So feel free to visit our nutrition cluster website. And the next slide. And if you need support, you will find on the website, as indicated on the slide, a button about request support. And you can really post any kind of support you need, and the team will see how to respond to it. Next slide. And so, yes, my last words for today. So with this, I'm closing the webinar. When the webinar will stop, there will be an evaluation form that we will be asked to fill it, an evaluation form. So please take a few minutes to do it. It's important for us so that we can improve our next webinar. Thanks so much to everyone. Thanks so much to our speaker, and see you in January.